Hey everyone, today we're going to go over the surgical airway, known as cricothyrotomy. So, quick thing for the class, if you have cell phones on, we're just going to have them turned off. It's only last 15-minute presentation, so we're not going to deal with any interruptions today. So a quick overview, we're going to just quickly follow it down. I'm not going to read everything off to you because everybody's an adult and can read. But we'll go through the indication, contraindications. We'll go briefly over the anatomy, equipment needed, and we'll get into the procedure. Once I'm done with everything, we'll get into the mannequin, and we will do the procedure step by step. And at the very end, we'll go over it and basically any questions. So the definition. Wikipedia's definition of cricothyrotomy, also called a cricothyroidotomy, is an incision made through the skin and cricothyroid membrane to establish a patent airway during certain life-threatening situations, such as an airway obstruction by a foreign body, angioedema, which is swelling, massive swelling to the face and deep into the tissues of the back of the throat where you can't see to get a tube passed, and also massive facial trauma. And with that, you gotta worry about, you can't get a bag, BBM to seal, the mask to seal around the face to where you can really give the patient ventilations that's needed if they're having the issue. Cricothyroidotomy is one of the last procedures that we usually go to in the scheme of airway. It's not indicated if you can get a patient in airway managed any other way. We do have a contraindication that a patient has to be at least 12 years or older. We're talking about the airway anatomy. So you can see where the thyroid cartilage is and the cricoid cartilage. So what we're looking for is the membrane that's right in between the two where we're going to go in. And I was talking about something that you can get the edema and all this tissue can push back towards the back and cut off your access to be able to get in there. Due to the anatomy and where it's located, it can be a bloody procedure. You can just expect it. So we're going to prepare for that when we prepare our equipment. You can cause some trauma, but for the most part, the area that we're dealing with, we get away from most of the anatomy that you can do damage to. It can cause complications if you get a little overzealous with some of your cuts. Again, you're looking at the thyroid cartilage it can also be known as the Adam's apple on males, and you're feeling for that main stiff cartilage that sticks out and is the most prominent point on the neck. When you reach for it, you feel it, you start palpating distally, you'll feel the next prominent ring, and that's the cricoid cartilage. And we're looking at the little space that's in between both of those. Equipment we're going to need, you're going to have your gloves. We got to have some safety glasses because you do have the chance of getting into arteries or veins, and with the breathing out, you can have blood splatter, and you don't want to get that in your eyes. We're going to have suction ready. You're going to have either a betadine or chlorhexidine prep to clean the site. You're going to have your scalpel to make your incision. The protocol we use here in Henderson County is using a needle attached to a syringe to go in first that finds your landmark. And then you either have a 6-0 ET tube or a pre-manufactured device like the Shiley tubes that we carry. You have a 10mm syringe that inflates the balloon on the end of your cuff to secure it in the trachea. You have your secure device that secures that device around the neck and keeps it from being dislodged. We have end-tidal CO2 monitoring. Ours is through our Zoll monitors, but it is required on any time we do an advanced type airway. You're gonna want bandaging materials, because like I said, it does create some bleeding, and you're gonna wanna be able to do something about that. You have your BVM, with O2 supply. You're gonna have your sharps container because you have that scalpel you're gonna have to do something with, and you're not gonna wanna try and recap it, because you can create injuries. And again, like I said, an important thing there was your eye protection. So when you get ready for your procedure, you're gonna have everything ready and out. You're gonna have all your BSI on, your gloves, your eye protection at a minimum. You might even wanna wear a gown, just to protect you from the blood spray. You're gonna put the patient in a supine position, like I've done on this gentleman here. As long as there's no cervical neck trauma, you're gonna hyperextend the neck because it's really gonna make the anatomy stand out and make it easier for you to find the landmarks. You're gonna administer 100% O2 as best you can for this patient, trying to get them breathe, if they're breathing somewhat on their own, whether it's by a non-rebreather, whether you're trying to bag it in the best you can, just some route, and then you're gonna have your oxygen ready for when you perform the procedure. You're gonna position yourself at the patient's side up near the neck. That way you're looking down and you can visualize the anatomy and locate the anatomy where you're at. It's recommended, as long as the patient is not moving around, you can put your equipment either on their chest or just have it really nearby to where you can get to it. I always recommend when you're prepping the neck for the surgical cric with your chlorhexidine or your betadine, to do the fingertips of your gloves of what you're gonna be touching and holding, because if you clean the area and then you put something dirty on it, you're just defeating that whole purpose. So if you go ahead and do your fingertips at the same time, you'll be good to go. And I recommend having some towels prepped and ready, like next to the patient's neck. That way you can stop any bleeding that may occur. With your non-dominant hand, you're gonna stabilize the larynx. You're gonna locate your landmarks of the thyroid cartilage. You're gonna maintain with a C-type grip on the thyroid cartilage. You can feel down with your index finger. You can find the next heart and get your cricoid cartilage, and then go for the spot in between. Keep your finger marked there, and you reach over and you can grab your syringe that has your needle on it, and you're gonna go dead center line of that space. And as you enter the needle in, you're gonna withdraw on the back of the syringe to aspirate for air. And as soon as you get that quick rush of air, you know you're in the trachea. So you're gonna stop advancement there, hold it in place. You can clamp to it to make sure you hold it in place if you want. But at that point, you can let go with your non-dominant hand, hold the syringe with the needle in place, grab your scalpel, and we make a 1-inch incision vertical above the needle and below the needle. And that helps us separate the tissue out to where we can get more access to that cricoid membrane itself. After you've made those incisions, you'll use the back part of the scalpel, and you can use it and you can kind of spread the tissues out to get down to that cricoid membrane. Once you get to that cricoid membrane, in a jabbing type of motion, you penetrate down and make a 1/2-inch incision to the right and to the left of your needle insertion site. Once you get it, you can, there's several things that we can do. You can use your finger, you can take the bougie, but you're gonna put that in that hole to keep it marked while you get your Shiley tube or your endotracheal tube to insert. During that insertion, you're gonna grab the tube, slide it in a downward manner, and you're gonna inflate your tube, and then secure your device around the neck. At this point is when you would add your bag valve mask to it, and your end title device, which would help confirm. You're gonna look for the rise and fall of the chest when you squeeze the bag, and you're gonna look for your end title readings on your monitor. You're gonna document how far in you went. You're gonna document what tube you used, whether it was the Shiley. You're gonna document the placement and its depth if you're using an end title tube. Some of the complications was talked about that you could have, you can actually get it in a false passage that's beside the trachea, which can be reamed out if you're jamming, just trying to jab a tube in. So you're wanting, if it's not going in easy, you're most likely not in the correct spot. You can do damage to the thyroid gland. You can cause subcutaneous air. You can cause damage to the laryngeal nerve. And again, you can see where we're going into this little space and all the blood vessels that are alongside it. You got your glands off to the side, so it's going to be harder to get into them and mess with those. So let's get into the procedure. We got our suction. We'll have it ready for needed. We're going to hyperextend the neck. Keeps it getting oxygen the best way we can. We've got our tubes. So in the Shiley that we have comes with an introducer. And it also comes with another tube that you can insert for afterward if you need a suction. So we'll have our equipment prepared, laid out. We've got our cleaning device. We're going to have our gloves on. We're going to clean, prep. We're going to clean everything. We've marked our thyroid cartilage. We're holding it in that C manner. We're palpating down for the cricoid, and then the membrane in between it. When we find it, we're going to insert the needle, and as we insert the needle and get air, we know we're there. We hold still. You can actually take that off. You get your scalpel. Come in, you make your 1-inch incision above and below to where you can access the membrane. You use the back of it, you spread it apart where you can get to your membrane, and then you go in and you make a 1/2 inch stabbing incision on each side, and then I'm using my finger. This would be deposited in my sharps container. I have my device. I follow it down the hole. Inserting it. Pull your introducer out. Inflate your tube. You want to put the tube in place. I'm on a bag, and I've got my end title hooked up to my monitor. I'm gonna get my partner to help me out. But we're gonna get it all connected up. Check our readings on our monitor. Check our chest rise and fall. And then we got our secure device that I'm gonna have my partner put on while I'm bagging. And all it does is simply goes over the hole. Somebody will have maintain holding the tube in place, making sure it's not gonna come out. And then it just simply wraps around the neck and secures back on itself with Velcro. Any questions? Thank you all.